Now to our Revive and Thrive segment. You know, February is American Heart Month, and this morning we want to focus on how female patients in particular can reduce their risk of heart disease.
Yeah, it's a leading cause of death for American women, but many don't know as much as they should about troubling signs and symptoms, and that's important. So joining us now is Dr. Seema Prusnani, a cardiologist at Kaiser Permanente in Santa Clara. Good morning. Thanks for being here. So let's get right into this. How are symptoms and risk factors for heart disease sometimes different for women?
Yeah, well, good morning, and thank you so much for having me here today. Such an important topic. So as you mentioned, February is American Heart Month. So it is a time when we ask everyone, but especially women, to focus on their heart health. As you mentioned, heart disease is the #1 cause of death in both men and women, but it tends to be less recognized in women. Women tend to be less aware that their symptoms may be heart-related, and they often delay seeking care when there may be something urgent going on. The most common heart problem that we see in women is something called coronary artery disease, and that refers to the accumulation of plaque in the arteries that supply your heart with blood. Plaque is the result of decades of cholesterol and inflammation buildup in the artery, and it can prevent the heart from getting enough blood flow. The other heart problem that women and men need to be aware of is something called congestive heart failure, and that can be associated with coronary artery disease, and that refers to the weakening of the pumping function of the heart. In addition to traditional risk factors, many are aware of diabetes, smoking, being overweight, obese, having high blood pressure, high cholesterol. As risk factors for heart disease, women have unique risk factors that can increase the risk of heart disease. So having high blood pressure, hypertension, or diabetes during pregnancy, something called gestational diabetes, or even going through menopause at an earlier age, are risk factors for a woman for having a heart attack later on in life.
So as a man who loves his sisters and his mom, my question is this: how can men be better allies and advocates to help those we love get the care and the treatment that they need, the personal investments that they need every day to make sure that they live long, healthy lives?
I love that. So it's important to think about, your moms, your sisters, your daughters, your friends. And there are 3 things that I would recommend really for prevention. #1 is awareness of your body. So we need to first be aware of our body and the symptoms we might be experiencing. Women tend to present with different symptoms. So we think about a heart attack as the elephant sitting on your chest, severe chest pain, radiating to the jaw, the left arm tingling. But women often present differently. They might not have chest pain. They might have upper back pain or abdominal discomfort. They might think they're having acid reflux symptoms. They may be feeling faint or excessively tired. So the first thing I recommend is awareness. If you are having any new symptoms, or if your loved one is having any new symptoms that they've never reported before, obviously talk to your doctor, seek medical care. #2 is understanding your risk. So having regular checkups with your doctor should include making sure you've had the right screening tests. This would be checking your blood pressure, your cholesterol, screening for diabetes. But your doctor may want to do additional blood tests, or sometimes even imaging tests like a coronary artery calcium score, to better understand your risk of having a heart attack or stroke. And then the third thing that I think is extremely important is lifestyle. So being active, getting enough exercise, getting enough sleep, keeping your stress levels down, and eating a diet that is predominantly whole food, plant-based. Those are important lifestyle tips for keeping your heart healthy, as well as your loved one's hearts healthy as well.
Oh, really good information. And really, when you feel something's not right, take the initiative to take care of yourself. Dr. Seema Prusnani, we really appreciate your time from Kaiser Permanente. Thank you so much for joining us this morning.
May we all smile like the good doctor. Thank you so much for that.
My pleasure. Have a great day.
You too.